More than 200 medical professionals, doctors, nurses, and technicians, among others, were joined by an overseas delegation including members of the World Health Organization, the Pan American Health Organization, as well as the Kennedy International Logistics and Services, bridging borders with compassion to start the rehabilitation process of 4 major hospitals across 4 parishes in Jamaica that sustained the most damage from the powerful Category 5 Hurricane Melissa on October 28. And although the financial damage is still being assessed, assistance has started to reach the health sector. The Minister of Health here in Jamaica, Christopher Tufton, he led a team of 200 volunteers across 4 hospitals.
We decided to establish a care crew, essentially to visit those hospitals, starting with Falmouth, Cornwall Regional, Noel Holmes here at SAB, and also Black River, to give support to our team members who have been impacted. We felt that we are fortunate, those of us in areas that were not affected, and we're here to give support.
My main reason is that it's something that I like to be a humanitarian for my country. So if it's this what I can do to give my assistance, then I'll do it.
As a Jamaican, that is very important to me, and it is most important when you are doing it for your brothers and sisters to know that they are in need of help and support. And once you are able to, I think you should just rise to the occasion, as one of our popular artists would say.
Rise to the occasion, look at yourself and say you're strong. No one can stop you, oh, yeah.
So we have been moving out the things that can be salvaged out of this building here. Anything that is usable, we are moving them out.
International partners, including a mission from PAHO, also visited the 4 worst affected hospitals in Falmouth Trelawney, Cornwall Regional in St. James, the Noel Holmes Hospital in Lucy, and the Savannah Lamar Hospital in Westmoreland, which have been stretched to their limits.
So here we are on Sunday, after the storm Melissa has raged through Jamaica. And in response to a storm with this kind of impact, the international community responds to that kind of requirements when a health system is struggling to respond to the needs of the people. One of the ways that a international community responds is through the dispatch of an emergency medical team together with the resources associated with that team. So what we're talking about in layman's terms is a field hospital and the resources associated with a field hospital. So what we're doing today is working with the Ministry of Health and Wellness, who've asked us to come here to support 2 teams that are looking to see what's unfolding here at Cornwall, to see how what they offer, if it meets the needs of people in Jamaica and the government of Jamaica.
The importance of assistance from international partners can't be understated. They've been here, they've been contributing, and they're ensuring that supplies come in for the most affected Jamaicans across the island.
We met yesterday with multiple different agencies, all of the different ministers, the Minister of Health, Transportation, etc. We have brought in the Starlinks and all of the communications. We had SpaceX and we had Starlink on our aircraft yesterday. We brought in over 600 of those so we could help get your guys' communication systems up. Judah One Airline right here, they helped fly us in and our teams in. We have nurses right now on the ground. hillcorp.org, which is a great medical facility. They've been out on the helicopters in the most hurt areas like Westmoreland, Black River area. And so we work together as a collaboration. We're bringing in, for example, right now we have 111,000 box meals coming in, and we have 38 pallets of water that will be dropped tonight in Montego Bay. So we're getting out all of this life-saving blood, right? The water, the food right now to these most impacted areas. We have our medical teams out there doing triage and then assessing the damage. And then, of course, again, we're going to be bringing in a 10,000 square foot ballistic dome tent that can house up to over 200 beds to help facilitate with our doctors under HillCorp. And then, of course, Kennedy International Logistics to help with the logistics side of things to help facilitate this.
We are just assessing the extent of disaster. We're still assessing the ground, but we have our team on standby, medical professionals, doctors, nurses, EMTs ready to come by. We were in big discussions with the Ministry of Health yesterday, and they are talking about us supporting this amazing hospital here at Cornwall, what we call the surge capacity. So when there are not enough beds in Cornwall Hospital to serve the patients, this is where we come in. We bring our equipment, our staff, and hospital beds to ensure the safety of our Jamaican people so that they don't decompensate.
And importantly, it's not just a question of the infrastructure, but the human resources that have struggling with the impact, the psychological impact, the mental health impact of this tremendous storm that's gone through. So there has already been a deployment of one emergency medical team back in Black River, where I was with the Minister of Health and the Prime Minister on Wednesday. Now we're prioritizing other hospitals, whether it's Noel Holmes, whether it's Falmouth, whether it's Cornwall, whether it's Savannah Lamar. So we're going through the process with our partners, the NGO partners, civil society organizations, other governments around the world as well, to understand, all right, what is the offer that these different partners have and what are the needs in these different places. But we also have to recognize that it's not just about hospitals, it's about primary health care, because primary health care is where people access most of their health services and help keep people healthy. When we're talking about these kind of situations, of course, people have need for critical care. That's what hospitals are for. But also we need care day to day to keep people healthy.
The local doctors, to include Dr. Garth McDonald, Senior Medical Officer at the Victoria Jubilee Hospital in Kingston, was among the volunteers. He was pleased to see the assistance being rendered, as it says Jamaica is not alone.
A lot of personnel are here from the Ministry of Health. There were also some personnel from the Indian High Commission as well. So I came down on that bus because that's part of a medical mission. So they were here earlier giving out medication. Dr. Shandalo and the rest of the team, thanks to them. I was here early with them. We took the route through St. Elizabeth and Bamboo Holland, and the island is devastated. The coastal regions are totally devastated. Westmoreland is also severely traumatized, and we know that once patients are here and need our help and assistance, then we have to respond.
Human capital is the best capital you can have, because we are here doing heavy lifting, but we are also here giving spiritual, emotional support, because our colleagues are happy to see us here, helping them all the way from Kingston. So human capital, 100% a plus.
The amount of damage is mammoth. I think it's going to take much more than just governments and oppositions here. We need international help. Some volunteers are here from the UK as well. And, the field hospital here at Savlamar was damaged. They will need to rebuild in order to get this official structure up that can be used as a clinic. It houses part of their maternity unit. So it is an opportunity. Even though in the disaster, it is an opportunity for us to build and make the spaces greater for the health of our people.
The big problems we see after a storm like this, firstly, are skin and soft tissue injuries and orthopedic injuries. This happens when people are in the water for too long, they bypass trees, they injure themselves. So it's really, those are the biggest: skin, soft tissue infections, and orthopedic injuries, followed by respiratory illness. And then, of course, infectious diseases. Now, with infectious diseases, you'll see a numerous amount of cases. Skin, you have diarrhea diseases because of the contaminated water. And the other thing, what I'm very concerned about in Jamaica, is mosquito-borne disease. Now, with the stagnant waters, this is where mosquitoes thrive. And we do know there's dengue in this country through the Aedes aegypti mosquito, and that brings a lot of concern for me as well. So ensuring we're bringing clean water, food supplies. It's a whole package that Heal Corp is doing, not just medicine, but this inevitably affects care as well. Having clean water, access to healthcare, all of this go together.
Our most needful commodity right now is water. Listing them. Number one, water, because our 70,000 gallon reserve tank is completely finished, and we have to be trucking water from yesterday. 10 truckloads are $3,000 per gallon at $50,000. You do the math, and we have to be going now. Second most urgent commodity is diesel fuel to fuel our generators and our vehicles as well to go in the field. As you know, the road becomes clearer. We have more cases coming in, so the influx of cases will cause a stress on the resources that we have.
The work of volunteers 5 days after Hurricane Melissa ravaged Jamaica is invaluable, and what they've done is nothing short of heroic. When darkness falls, it's the people who bring the light. From Falmouth to Savannah Namar, this mission has proven that healing Jamaica begins with healing each other.